Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College. I'm also Principal Investigator of the Tennessee Community Gauge Alliance Against COVID-19, also known as Tennessee SEAL. Today is Monday, March 21st, 2022. And today I'm going to start by providing an update on where we stand with COVID-19 and where things appear to be heading. I will then provide an update on data nationally and in Tennessee counties, both by new cases, hospitalizations, and deaths, and then provide an update by COVID-19 community levels based on the recent updated CDC guidance. I will follow this up with a more detailed discussion of the stealth and Delta Cron variants of COVID, and then provide an update on recommendations for a fourth dose. While COVID-19 numbers overall continue to look good, a recent upturn in the BA2 or Stealth mutation of Omicron, we need to be cautious on how we cut back on preventive measures. Despite the current decline in cases, hospitalizations, and deaths in the United States, Dr. Anthony Fauci, the Biden administration's top advisor on the pandemic, predicted on Sunday an uptake in coronavirus infections similar to the current increase we are witnessing in Europe. So, in starting, COVID-19 activity continues to wane across the United States, with hospitalizations and new case reports both reaching their lowest levels since last summer. New cases of COVID-19 nationally have fallen to about 30,000 per day, while corona's hospitalizations have fallen more than 80% from their January peak to around 25,000 per day from more than 150,000. Progress has not been as swift, however, with regard to COVID-19 related deaths. Around 1,200 deaths continue to be announced most days, well below the peak of the Omicron wave, but still extremely high. More than 965,000 deaths have been attributed to COVID-19 in the United States since the beginning of the pandemic. Every state is in far better shape than it was at the height of Omicron, and almost every state continues to see significant declines in daily case reports and hospitalizations. In Tennessee, newly reported cases of COVID-19 are down 73% to 309 per day over the past 14 days. This amounts to 5 cases per 100,000 of the population. This is much lower than the national average, which is 9 cases per 100,000 of the population. While hospitalizations are down by 49% over the past 2 weeks, the rate of hospitalizations in Tennessee is still very high, at 9 per 100,000 of the population. This is compared to the national average of 5 cases per 100,000. In addition, ICU visits are down 54%. In sharp contrast, however, deaths from COVID-19 in Tennessee are up a staggering 88% over the past 14 days to 57.3 per day, which is very troubling indeed, and it's unclear as to why. Deaths in Tennessee are now at 0.84 per 100,000 of the population, compared to a national average of 33 per 100,000. Tennessee also ranks 5th nationally for deaths per 100,000 due to COVID-19. On the vaccine front, only 54% of the population of Tennessee is fully vaccinated, no change over the past month. And over the past 2 weeks, only Campbell County has a rate of new COVID-19 cases above 31 per 100,000. 3 other counties, Chester, Henderson, and Scott, have rates between 20 and 30, and 13 other counties have rates between 10 and 20 per 100,000. 78 Tennessee counties now have rates of COVID-19 per 100,000 of the population over the past 14 days at below 10. Using the new CDC COVID-19 community level guidelines, only Claiborne County remains at the high level of community transmission. 7 other counties, including 6 in East Tennessee and 1 in Central Tennessee, are at the moderate level of community transmission. They include Lincoln in Central Tennessee, and Campbell, Sullivan, Hawkins, Washington, Unicoi, Johnson, and Carter counties in the far northeastern region of the state. The CDC recommends that for persons that live in counties in the medium range to stay up to date with COVID-19 vaccines, wear a mask in public places, and take other precautions if you are immunocompromised or in a high-risk group, and to get tested if you have symptoms. If you live in a county that is at low community risk, the CDC recommendations are 1, to stay up to date with COVID-19 vaccines, and 2, to get tested if you have symptoms. Next, I'm going to revisit the BA2, or what is also called the stealth variant of the Omicron virus that has appeared in a number of countries around the world and increasingly in states in the United States. BA2 now accounts for almost 1/4 of new cases in the United States last week. The subvariant is estimated to be 30 to 50% more contagious than the previous version of Omicron, BA1. So far, BA2 doesn't appear to cause more severe disease, and vaccines are just as effective against it as they are against other forms of Omicron. But BA2 does show signs of spreading more readily. Early evidence suggests that the stealth variant of Omicron may slow the steep decline in cases, but it is not likely to change the overall course of the pandemic. This means that higher peak infections in places that have yet to peak, and the slowdown in the downward trend in places that have already experienced peak Omicron. Persons at highest risk for BA2, or the stealth variant, are those who have not yet been boosted. Experiments on BA1 now underway may help scientists sharpen their projections. In recent days, scientists have reported that a hybrid of the Omicron and Delta coronavirus variants has been popping up in several countries in Europe. The hybrid has been given the nickname Deltacron. Although the Deltacron variant has existed since at least January, it has not yet shown the ability to grow exponentially. For now, Deltacron remains just a variant of interest. Finally, as coronavirus case counts continue to plummet across the United States, people's immunity may be declining. Late Thursday, Moderna sought emergency use authorization from the Food and Drug Administration for a second booster shot, i.e., a 4th shot for all adults. The company's request came just days after Pfizer and BioNTech filed for emergency authorization for a second booster of its coronavirus vaccine for people 65 years of age and older. There is still no consensus among scientists, however, that a 4th shot is now needed, except for perhaps for the most vulnerable. We are likely to hear much more about the benefits of a 4th dose in coming weeks. So what do these changes mean? The stealth variant of Omicron is spreading at a much faster rate than the original Omicron variant. This means that if you are not yet fully vaccinated, your chances of getting COVID-19, if you are not wearing a mask and social distancing, is once again increasing. COVID-19 vaccines protect everyone ages 5 years of age and older from getting infected and or getting severely ill. Even for persons who are fully vaccinated and boosted, there still remains a risk that you will get COVID-19. But for persons who are fully vaccinated and boosted and who get COVID, i.e., a breakthrough infection, the vaccine significantly reduces the likelihood of hospitalization and death. But it's your choice how much risk you're willing to take. So for now, thank you for listening. This is Dr. Paul Juarez from the Tennessee SEAL, wishing you a good day. Be